Welcome to Working for Women, the Independent Women's Forum podcast, where we are changing the conversation about women and public policy for the better.
Hello, this is Carrie Lucas, the president of the Independent Women's Forum, and welcome to our Working for Women podcast. I'm excited today to be here with Julie Gunlock, who just had a great piece in the Wall Street Journal. Julie, thanks so much for joining me.
Thanks for having me.
And Julie, you bring up in the Wall Street Journal a warning that's coming out of the Center for Disease Control. Can you tell us a little bit about what's going on?
Yeah, so the Centers for Disease Control, the CDC, is very worried that this country is about to endure an outbreak of measles, and they're warning people that they really need to be better about vaccinating their kids. This warning is partly based on a study that came out in a medical journal that shows herd immunity, and I know I'm getting into a little bit of medical jargon here, so I'm happy to explain what herd immunity is. But this medical journal said, look, we are really in danger of what's called breaking herd immunity, and that means that when a large swath of the population is immunized, it receives a vaccine, it protects those who cannot be immunized. For instance, people who might have certain cancers. So people who are immunosuppressed, again, because of cancers or HIV, they might need to skip vaccinations. Another group of people who can't get vaccinations are newborns. I think most moms know that when you first have your child, you have to go a couple weeks before they get, or in some cases, there's a whole schedule, but it goes over the first year that you get your first shots. And so that's another group of people who are vulnerable to those who are not vaccinated, to those who might get these diseases.
Can you back up a minute? Because I think that there was 15 years ago, I feel like I would have never heard about the problems of measles. Because it was one of those, just the list of the vaccines that you and I got as kids, and then I remember when my first was born almost 12 years ago. It was one of the ones that I think she got at around a year, and it was just I didn't even think about it. I was never warned about the potential, but it wasn't something I worried about in the year before Molly was old enough to have her vaccine. So what's going on? Why has there been this increase in people not accepting the vaccine?
Yeah, I'm glad you backed me up, because it really is important to sort of frame this correctly. In 2000, the public health community was sort of celebrating the fact that measles, a very infectious disease, measles, had been eradicated in the United States. And I think it's important to explain why they use the word eradication. That doesn't mean it vanished. That didn't mean that it was gone off the face of the earth, like some other diseases that we've seen. But what that means is that in the United States, it was sort of gone, and the only way in which it was appearing is if travelers, tourists, people visiting this country, and frankly, some illegal aliens were bringing it into the country because they were not vaccinated. And so they would then, go to, for instance, we saw a huge outbreak at Disney World, and this was traced back to people who had come into the country. So in 2000, that's the kind of thing we were seeing. Just occasionally there'd be an outbreak, they'd quickly take care of it, but it wasn't something that was cropping up from the U.S. population. So they were celebrating that, and that really was great, because it's very easy to control those kinds of outbreaks. Fast forward 17 years, and we are seeing these outbreaks, homegrown outbreaks, and the reason for that is in the late 1990s, there was a doctor, and Carrie, interrupt me if I'm going a little too far into this or if you have a question. But
no, it's okay.
In the late 90s, a British doctor named Andrew Wakefield, he began to publicize, and he released a study, and the study was published in a reputable journal, which later retracted it, that's a big deal. When a reputable scientific journal retracts a study, that's a very big deal. It's rarely done. And they actually retracted it because this doctor used fraudulent methodology to get his results.
Okay.
He was later, it was so bad, this study was so bad that his medical license was later taken away. So he can't practice medicine anymore. Yet this study, and what this study said was there was a connection between the measles vaccine and autism. Well, naturally, everybody flipped out, right? Because can you imagine, you're a young mom, the doctor's saying you need to get this measles vaccine, and you're thinking, oh my gosh, could this cause autism? Now, at the same time, we started to see a rise in the autism rates. That rise is because the definition of autism began to expand. So you had more people fitting into this bucket. But this was sort of very bad timing, because at the same time you had this expansion of, or the numbers increasing of autism, you had this study, this fraudulent study that came out that said, hey, it's because of the measles vaccine. So that that was sort of the start of the anti-vax movement. Now, of course, the anti-vax movement has been around since vaccines came about. There's always going to be conspiracy theories out there, but this really fed it. And then you had, so what the difference was, is it wasn't just conspiracists that suddenly were anti-vax. It was very reasonable parents. I will admit publicly, I actually delayed my first son's vaccines because I was afraid of this. He was born in 2007. It was sort of the height of the anti-vax movement. And I, too, was nervous about this until I actually read and realized that this was all based on a bad study. So what has happened? So in 2000, you had this the eradication of the disease. Fast forward 17 years, you've gone through all this anti-vax hysteria. You've gone through this fraudulent study that the media really, really fed. The media had a lot of headlines on this. At first, it was thought of as legit. So there were a lot of really scary headlines. The sort of corrective press reports. We know how this works. The scary headline gets a lot more press than the sort of reassuring, oh, sorry, we were wrong. That gets far less media attention. So again, fast forward 17 years, measles is now spiking. It is now back. It's no longer eradicated. And what has happened is you have such a break in herd immunity. In other words, the CDC says that if there's a 5% reduction in the number of people who vaccinate their children, it will triple the number of infections among 2 to 11-year-olds. So what we're seeing, for instance, in certain areas, for instance, in Wisconsin, let's say Oregon, okay, 6.4% of non-vaccinated children, Vermont 5.7%, Wisconsin 5.4%. Now those are the higher states, but we're seeing an increase in each state, and the CDC is here saying, you got a 5% non-vaccination rate, that is going to cause a massive outbreak, and that's why everyone should be nervous.
Okay, that's it, and it's interesting. I know that, of course, I obviously whenever you get a vaccination, you have to kind of sign a waiver, and they tell you all of the horrible things that might go wrong. But I'm sure that there are some. Oftentimes, babies get sick after a vaccination, or have a little bit of flu-like symptoms. How worried should parents be? Is this just a the rates of accidents or bad reactions for vaccine is extremely low. You are much more likely to get measles. You are much more likely to get an infectious disease than have a bad reaction from a vaccine. It is extremely rare. Extremely rare. It's hard to measure, but it does happen. And there actually is a fund, a federal taxpayer-funded fund to help people who are injured from a vaccine. So I don't want to suggest this doesn't happen, but it's so dangerous when you go down this path, because, you say, it's like that line in Dumb and Dumber where she says something like, there's no chance. She gives him a percentage. She's like, there's, 1,000% chance we're not going to get together. And he says, so you're saying there's a chance. Or she says, a 99.9% chance we're not going to get, and he says, so you're saying there's a chance, right? It's that kind of argument where we can talk about all the rare cases, and I don't want to say that there aren't vaccine injured people out there. There are, but it is you always have to do a cost risk analysis, and that is, are you going to look? We live in a world where infectious diseases exist, and you have to make that calculation. Point whatever 0% chance that your child is going to have a vaccine injury, or now I think it's also important to understand, among the injuries from vaccines, autism is not one of them. It has been proven that there is zero connection between autism and vaccines.
And so that is the one that really scares people the most, and that is the one that is pushed by people like Jenny McCarthy and many of these movie stars who don't know anything about the issue and have, either been sort of fooled by Andrew Wakefield, this British doctor, or have sort of are just or have some experience with an autistic child. The sad thing is these anti-vax pushers often use parents of autistic children. Autism is a very, kids on the spectrum, it's a tough issue. And kids that are severely affected by autism have very severe cases of autism. Some are nonverbal, some are actually disabled in terms of, not being able to sort of have a normal life. And parents of those children search and search and search for the reasons, because if you have any experience with autism, they really don't know the causes yet. There's a great deal of research going on, and frankly, a lot of people think it's genetic, but they don't know the conclusive reason, and that is why these are vulnerable parents. You're able to really capture them and say, hey, and what's so horrible about it is it shifts the blame. These parents take on the blame. They say, oh, see, I gave them a vaccine. I decided as a parent. And so it's a very useful tool for the anti-vax community. They're really able to utilize this group of parents, but it simply isn't true. And that's really, I think, the fear that needs to be debunked the most.
I think it's important. I think that we can very much respect the concept of parental choice. And and I would never call for, I don't think the government should be dragging parents and forcing them to vaccinate their kids. I do think that it makes sense to restrict access to public services like public schools, make it a requirement. But we don't have to, you don't have to go down the road of it being a government. And the good news is that I think we need to keep it in context, is that most parents are doing this. And that's why if you have a misinformed friend, you don't have to condemn them, or they're not stupid. It's just that they've, I think that we can kind of, try to spread the good news that this isn't something you have to worry about. And that's why,
right.
You should get your vaccine. It doesn't, I don't think you have to be on the side of government force No,
but there is certainly an argument for government persuasion, and that is children should not be going to public schools if they are not vaccinated. There are certain public services that you should not be able to access if your child is not vaccinated. And
unless they have a medical reason.
Unless, of course. Yeah. Now, look, there are medical reasons. Yeah. What we're seeing in public schools now is schools are allowing for non-medical exemptions. And your child can be perfectly healthy, but you have sort of a philosophical or religious objection to vaccinations. Now, I don't agree with that. I think that for non-medical, unless it's a medical cause, I think that then you should not send your child to a public school. I know this rattles some people, and I know this kind of gets people angry, but this is, again, this goes back to the common good and the sort of social contract that we have with each other, that we are going to protect ourselves so that we don't innocently infect other people. So one thing that you can do, I think, is, again, besides being sort of a good and a happy warrior on this issue. Again, I think it's important when you talk to someone on Facebook, not criticize them, call them stupid. I mean, I will tell you, it gets pretty frustrating, okay, to argue this issue. But it is important to at least give people better information, better sources of information. There's a lot of conspiracy sites out there. There's a lot of sort of junk science sites. So I think it's really important to give people better sources, and IWF has a lot of good sources on this. And I think the other thing that is important is more and more states now are getting rid of non-medical exemptions. Part of the reason that the anti-vaccination movement has thrived and that we're seeing this break in herd immunity is because people are increasingly, it is up 19%. Non-medical exemption, requests for non-medical exemptions are up 19%. And so anybody can ask for an exemption now and still go to public schools where all children gather, all people gather. And so I think that is so I think supporting those kinds of things are important. And again, being a good advocate for vaccinations is the most important thing, yourself and on social media sites.
Great. Well, Julie, this is a conversation I think we could go on for a long time on, but I wanted to encourage everybody to come and get more information at IWF.org. Thanks for taking your time to listen to this edition, and please come visit us again at IWF.org, where all issues are women's issues.
If you enjoyed listening to this podcast, please give it a thumbs up, share it on social media, or stop by IWF.org for similar content.